Hello, welcome back. So today's topic is diabetes. Most of the people know what is diabetes. At least they would have heard type 1 diabetes, type 2 diabetes, and they have to take medicine forever. All these things people know. But most of the people don't understand, in a simple way. So they know the disease technical way. So they get confused, and most of the people ask, okay, if I become a diabetic, I have to take medicine forever. If I take insulin, it's a lifelong. See, to understand simply, every human being or every human cells need sugar and oxygen for its function and survival. Whatever we eat, whether it's rice or chicken, banana, everything is digested into simple sugars and maybe oxygen and goes to the brain, bone, muscle, everywhere. So sugar is essential, and to do the job of the sugar metabolism and to carry the sugar into the cell, insulin is very, very important. That is the main hormone which is secreted with the pancreatic beta cells. The beta cells are very rich in the tail of the pancreas. Every human beings have almost 1 billion cells of beta cells which secrete insulin. In turn, it metabolizes the sugar part and transports everything into the cell. So suppose, what is diabetes? When the insulin level goes down, either because of complete loss of the cells or the functioning of the cell is very less, so effective or efficient insulin is less. So what happens? The sugar rises. When the sugar rises, it cannot go effectively into the cell. So all the complications of diabetes will come. And to understand little more simpler, suppose there is a glass of water and you add to that sugar. What happens? The water becomes thicker. The same way, when the blood sugar rises in the blood becomes thicker. When the blood is thicker, it cannot travel easily in the blood vessels, especially in the small blood vessels. The blood cannot go in. So eye, kidney, your leg, all have very small blood vessels. So they can be affected because of uncontrolled diabetes. High blood sugar, thick blood, it cannot travel, so it can affect anywhere in the body, but mainly eye, kidney, heart, leg, all these things. The same way, suppose you have a sugar, so the ant will come, mosquito, I mean, all the insects, all these come to eat the sugar. The same way, when the blood sugar rises in the body, all the infections, the bacteria come in, so they get easily infection. So that is why you would have heard, when they go for surgery, you have to keep the sugar under control, otherwise the infection will come. Or they are very common with urinary tract infection, so common with oral infections because the sugar is high. So this is the basic way. Okay, now most of the people know only type 1 and type 2 diabetes, or adult or young type of diabetes. There are so many different types of diabetes, right from type 1. Type 1 is young people mostly, and there is absolutely no beta cells. Usually there are 1 billion cells. Now absolutely no cells to produce insulin. So if you take the tablet or anything, it won't work. So they need external insulin injections, and this is type 1. Type 2, there are some amount of beta cells. Say out of 1 billion, 20% is lost and you have 80%. So you take medicine, these medicines go in, they stimulate the beta cells to produce insulin. So according to the insulin level, your sugar comes down. This is mostly 95% diabetes comes to this category. So medicine is not insulin. The tablets are not insulin. The tablets, they go in, they stimulate the beta cells. Whatever the amount, some people have 80% of cells, some people have only 10% of cells. This is why even the same house, husband and wife will have a uncontrolled diabetes in spite of too many medicines. But husband with one tablet, even he may be taking sweets, but is it under control or easy to control? So the people confuse, I'm not at all eating, but why my sugar is not under control? But he is taking sugar, he is able to. The reason is the amount of cells, remaining cells. Of the 1 billion, how many cells are there? 80%, only 5%, 10 percentage. And not only 80% of cells, these 80% cells, how much of insulin they are able to produce, that is more important by these tablets. That is the reason why so many medicines are available in the market to increase the insulin secretion and sensitivity. This is type 2. There is something called MODY, MODY. There is maturity onset diabetes of the young. So these people, young people, but they will have like adult type of diabetes. Usually young people, insulin is very important, but these people can be managed with tablet itself. This is called MODY or type 5. And there is one more, LADA, LADA, latent autoimmune diabetes of the adult. The adult people get diabetes, but they behave like a young aged diabetes. So they need insulin most of the time. This is called LADA or type 1.5. Then one more diabetes called 3C. That is something mostly after the diseased pancreas due to alcoholic pancreatitis or surgery, or even whatever the some tablets that injure the pancreas, so beta cells will go down, and because of that they get diabetes. That's called 3C diabetes. And most of the people know gestational diabetes. People when they're pregnant, women get pregnant, they get diabetes, and mostly it is temporary, but they get back. 30% of the people will get back the diabetes within 5 to 10 years of post pregnancy. They will get back the diabetes. So these are so many types of diabetes are there. So it's all depends upon the number of cells remaining inside. So suppose you have no insulin producing cells, you need insulin only, nothing will work. Number two, if you have 80%, 50 percentage, 80 percentage, 40 percentage, so the medicines go in, they produce. So that is the reason why some people have a good control, are easy to control with one tablet, off tablet. Some people may not, because of the remaining cells, and the remaining cells also how efficiently they produce. And another category, insulin resistance, that is different altogether. It's a different ball game. So diabetes is a disease where insulin is low, sugar is high, so it's not going into the body, causing all the problems. So medicine is not given to cure the diabetes, but to tackle the complications that can happen because of the diabetes. So consult your doctor, and that is the reason why. So we don't, like suppose you have naturopathy, so control your diet, do exercise, so your sugar under control. No, each people it differs, but basic is diet, exercise. But depends upon, a three month old child can get diabetes, so the treatment is different. An 80-year-old man can get diabetes, so the treatment is different. So that is the reason why the market has so much of medicine, different medicines. And the same person who is taking this good medicine, good under control, after 5 years, the number of cells will go down, suppose attrition. So the treatment changes. That is the reason why you have to keep a watch on your diabetes by self monitoring your blood sugar and consulting your doctor. Thank you.